Welcome to the Congregate Living Settings Masking Campaign presentation. Today we'll speak about why our masks are still important, their directive and guidance changes, and their supporting documents that were released in June 2022, where masks are mandated and where masks are highly recommended. We'll speak a bit about masking policies and the exemptions to those policies, the masking benefits and reasoning why we should mask, how masks should fit and how they should be stored, promoting mask use with the clients and the visitors to your facility, and then some promotional resources for you to utilize. Why are masks still important? As the province continues to open and we begin returning to a pre-COVID way of living, we need to continue to remain vigilant. COVID-19 still poses a major health risk, especially to the most vulnerable of our populations whom we care for in our congregate settings. As we have learned over this pandemic, a layered approach to IPAC measures can greatly reduce the risk of transmission within our congregate settings. So masking continues to be just one of those IPAC measures. This presentation aims to provide you as a congregate living staff with valuable information regarding masking, how it can help protect you, those you care for, and also allow you the tools to continue to provide this knowledge to your clients and visitors within your settings. On June 11th in 2022, this year, a lot of things changed for Ontarians. So the Chief Medical Officer of Health memo was released and had into effect on June 11th that any remaining directives were revoked around COVID-19. So that included directives 1, 2.1, 3, and 5. Within these directives were the mandates regarding masking in public settings and specific organizations, including community or congregate living settings. So what has replaced these directives is the ministry guidance documents. So there's guidance documents for healthcare workers and specific organizations such as hospitals, long-term care and retirement homes, congregate living settings, and other healthcare settings. So the following guidance documents are listed here on the slide for easy access for you. Again, you can see the specific ones depending what type of congregate setting you are with, and also some additional tools such as screening for these settings. So we see here the guidance document for long-term care homes and retirement homes. If you're in acute care, a congregate living for vulnerable populations would be shelters, transitional, as well as group homes, as well as the guidance document for PPE for healthcare workers and healthcare entities. So that would also apply to congregate living settings, acute care, long-term care, and retirement homes as well. So under the guidance documents on the previous slide, when you look at their masking sections, in a lot of the guidance documents, they refer to these technical briefs in order to make decisions on masking protocols or mandates. So the two main technical briefs are stated here. So one is for IPAC for PPE with those suspected or confirmed with COVID-19, as well as one for IPAC measures for transmission risks within healthcare settings. Just at the end of June, an additional document was released to support the second technical brief here. So that was a frequently asked questions or a facts for the technical brief. And you can see here, we included it on the slide, just some of the important information you can find in this FAQ document. So question 1, how are the periods of high risk, transitional, and low risk determined? And what are the indicators and thresholds for movement between them? So these periods of high, transitional, low risk is going to determine what level masking you should be implementing or that is recommended within your setting. So question 2, can you apply this technical brief to other settings? So yes, you can apply these technical briefs also to group homes, correctional facilities, etc., even though it may not be specifically listed in there definitely these IPAC measures are fluent across all congregate care settings. So we do recommend go through both these technical briefs and also go through the FAQ, as it will answer lots of questions that you probably have around any changes that are occurring within your facility. Or if there's any questions that arise, this is like a good first stop for you to gain some knowledge around it. On the bottom is just some additional resources that can assist with masking and other IPAC measures as well.
First, we are going to speak about where masks are still required. According to the Fixing Long-Term Care Act, aka the Minister's Directive, and the Retirement Homes Act and MSAA memo, long-term care homes and retirement homes must follow the current Ministry of Health's COVID-19 guidance document for masking protocols. According to the COVID-19 guidance document that long-term care homes and retirement homes are directed to follow, it states the following for masking. Medical masks are required indoors at all times by staff, students, volunteers, and visitors. Staff include direct care staff and administrative staff. Masks should only be removed when eating in designated areas such as dining rooms or staff break rooms where other IPAC measures are in place. There is no exemptions for immunization status. Residents are not required to wear masks, but residents should be directed and encouraged to wear a mask when in common areas, especially when participating in extracurricular activities that they may not be able to maintain physical distancing. And they should be encouraged to wear a mask when receiving care if possible. Masks are not required outdoors for anyone, but recommended if tolerated when in close proximity to others. Other IPAC standard measures should be applied when masking is not in place. There are always exemptions, but we will get into those a bit later in this presentation. Masking is highly recommended for higher risk congregate settings, those who support clients with severe or multiple health conditions or transient populations. In these settings, COVID-19 and other infectious diseases have a greater potential to result in bigger health complications or death. It is strongly recommended for staff to wear a well-fitted medical or surgical procedure mask, and visitors should wear a well-fitted mask at all times when indoors at the congregate living setting. This is subject to very limited exceptions. Clients in a congregate living setting should wear a well-fitted mask in any indoor common areas where 2 meters cannot be maintained. Clients who are on additional precautions due to a suspected or confirmed illness should mask during direct care, if possible, unless they are subject to a masking exemption.
So while we have talked about the benefits of masking and encourage their use as we continue this pandemic within our settings, we also must recognize those that have exemptions as well. So we did read through the guidance documents and the technical briefs and try to make one slide including those exemptions. So you can go ahead and read through this slide, but I'll just kind of summarize it as well. So some main exemptions that apply to everywhere is children under 2 are not required to wear a mask. If you have a medical condition that exempts you, and those who are unable to mask and unmask on their own and fall under the Disabilities Act. So these exemptions are present in order to mitigate any possible physical and psychological injuries that may advertently be caused by wearing a mask. So example would be interfering with the ability to see or communicate. And this is all in accordance with the Accessibility for Ontarians with Disabilities Act and the Human Rights Code. Under long-term cares homes, if entertainment is provided by a live performer, so that live performer is considered a visitor. However, in order for that performer to do their talent, they have to remove their mask, then that is allowed. So they would be exempt to do so in order to perform. But you would want to also apply other IPAC measures here. So think of physical distancing and airflow. Are they using an instrument? Are they singing? Is there potential for droplets to move further than that typical 2 meters? So perhaps you need a little bit more physical distancing between that performer and the audience. Ensure that there's no fans assisting with blowing those particles further. So just look again at that airflow, other IPAC measures for that layered approach with that mask removal from the performer slash visitor. Those who are exempt should always be reasonably accommodated. So just keep this in mind. So, example, if someone's coming to a live performance unable, but physical distancing isn't maintained for this live performance as it's a smaller area or lots of people, this person's unable to mask. Perhaps you would want to seat them a little bit more in the outskirts or where there's a better airflow, or with that, at least make sure that they have that 2 meter distancing since they're unable to mask. You're all very good at this. We've been dealing with mask mandates for the last half a year at least. So it's easier for you to adapt, and you have been through this pandemic. So just keep those in mind as we continue on.
So why are we still masking? What are the benefits? As we are used to hearing by now, the best way to protect yourself and others against COVID-19 is with a layered approach. This graphic of the Swiss cheese defense shows how it's not just one IPAC measure or intervention that helps to protect us, but multiple layers of interventions added together. Recently, other IPAC measures such as high vaccination rates, expansion of booster doses, as well as the arrival of antivirals, has given Ontario the tools necessary to manage the impact of the virus, along with the changing variants causing less severe effects, allowing us to now reduce other IPAC measures, making life more enjoyable. Say, for example, you're in a setting where masking is no longer required. You may want to consider increasing other IPAC measures such as physical distancing where able to continue to apply a layered IPAC approach. For example, if you're able to be outdoors and maintain distance, you can remove your mask. Versus in a setting without those other measures, you may want to consider adding masks. For example, if you're unable to keep physical distance or poor ventilation, where there's evidence of higher community transmission risk, more layers or Swiss cheese are required to filter them out. Versus when there's a decreased community or transmission risk, you can decrease those layers of IPAC measures as well. Currently, for most settings in the general public, you are no longer required to wear a mask, but you should continue to wear a mask if it feels right for you, if you are at a high risk of severe illness, if you are recovering from COVID-19 or have symptoms of COVID-19, or if you are a close contact of someone with confirmed COVID-19 or symptoms of COVID-19. A brief overview of how masks actually work to provide you protection. Masks protect others from your droplets by containing them within the woven material so they are not expelled to the environment or air around you. Masks protect you from others because they filter out droplets from the environment around you, protecting your mouth and nose from any bodily fluids, splashes, or sprays. Masks come in different types and styles, reusable cotton and different levels of those, non-medical disposable, and then medical grade, which have an ASTM level rating of 1 to 3. Typically, level 1 is sufficient, but this is dependent on the level of exposure of splash or spray. N95s also come in different sizes and must be fit tested and assigned a size to ensure it creates a tight seal so no unfiltered air comes through. A point of care risk assessment, or PCRA, is important for the use of N95s when caring for an individual that is suspected or confirmed to have COVID-19. And the current guidance document for COVID with healthcare providers indicates this, as well as use with AGMPs, or aerosol generating medical procedures. Mask fit. If masks are reusable, they should be made of at least 2 layers of tightly woven material such as cotton or linen and should have a third middle layer of a filter type fabric. Ensure any reusable masks, the integrity is maintained after washing. Do not use masks if they have lost their shape or are in disrepair. Ensure the mask is the right fit for you. Masks are one size fit most, not one size fit all. Some individuals may require youth-size masks for smaller faces, while others may require ties instead of loops to get the best fit. Take your time and make sure the fit of the mask is proper to your face. Use both hands to form the metal piece around your nose. Do not pinch. And ensure the mask is high enough on the nose and be able to be pulled all the way under your chin. Medical masks, if they are colored, ensure that the colors are on the outside. Show your colors. Putting on facial protection and having it fit properly. Perform hand hygiene prior to handling any PPE. Take mask out of the box carefully, trying only to touch the loops and top mask. Ensure metal nose piece is at the top and colors are facing out. Place ear loops on both ears. With both hands, shape the wire to your face and nose. Ensure mask sits up higher to reduce fogging of eye protection. Hold the mask in place and pull down under your chin for a correct fit. Adjust mask so it fits comfortably and proper. You may have to adjust your loops and ties depending on the shape of your face. Put on eye protection, ensuring proper fit. Proper handling of masks. Perform hand hygiene before taking a mask from the container. Masks are clean and in a shared container. You do not want to contaminate your own or others' masks. When you take the time to put on your mask, you're less likely to touch your mask while wearing it. Therefore, less likely to contaminate your hands and decreasing the amount of times you would be required to perform hand hygiene. Never share your mask with others, as this could create an opportunity for disease transmission rather than stopping it. Masks are not made to withstand large levels of fluid. If your mask becomes damp or wet, replace it with a new mask. Do not store used masks in a pocket, purses, or desk drawers. The droplets from inside and outside of the mask will transfer onto other items and your hands, contaminating them. If you have used a mask as PPE, so as a layer of protection while with a client on additional precautions, it must be removed prior to leaving that environment with all other PPE. Reusable mask care. Reusable masks does not mean that they can be used as extended use. For example, worn between clients on precautions. It means rather than throwing the used mask out, it can be placed in a laundry receptacle and laundered to be washed again and worn again. Ensure masks are laundered on a hot cycle and are fully dry prior to reuse. After handling dirty masks or dirty laundry, always perform hand hygiene. Removing mask for a quick drink at workstation. When removing your mask for a quick drink, remove by the ear loop only and hold in hand pulled away from your face. Replace loop around ear. If your mask requires adjusting, perform hand hygiene after touching your mask to adjust it.
When masks are being used as source control during the day, so they're worn throughout halls or common areas, you can utilize the same mask for part of that day. However, you want to ensure that you have a designated location for this mask when it's not being worn. So example, if you're at your desk and a mask isn't required. Now, that mask has droplets on the inside from you, on the outside from others, so you don't want to just toss it down anywhere and contaminate those areas. So having a designated hook or container where only that mask goes is a great way to avoid any contamination of other items. If you don't have a designated container or hook that you can utilize, then you definitely just placing a piece of paper towel or Kleenex or something down on the table before putting that mask down creates that disposable barrier that's easy cleanup for you as well. Recall when you're removing and putting back on your mask, try it again to only handle it by the loops or the ties so you're not contaminating your hands. If you need to remove clean masks from the original container, so example, you're like, oh, I'm going to a site visit or somewhere else, I need some extra clean masks. then you want to ensure that you are still keep maintaining that they're clean until point of use. So you don't want to take a handful, shove them in your purse or your bag or your pocket, because any of those other items that are within that purse, container, or pocket is going to contaminate those masks. And then you're putting those masks up to your face. So the best way to do this is create, again, a barrier. So it could be with a Ziploc bag, a paper bag, a designated clean mask container. Place them in the container of choosing first, and then you can put it in your purse or pocket or bag or any or vehicle, any other means there. And only put clean masks in there and treat it as if it was the original container. Never store dirty masks or clean masks in the same container as well, unless you're cleaning and disinfecting in it between use, which is highly unlikely. Um, so one thing we want to stress, especially now that it's summertime. So medical masks can't be frozen or overheated, otherwise they have to be discarded. So medical masks shouldn't be stored below minus 20 degrees Celsius. And right now, because it's summer, they can't be stored above 30 degrees Celsius. So these temperatures can be achieved quite quickly and more easily within vehicles. So even if it's only 22 out, it could be super sunny out, and your vehicle could be registering at 31 degrees Celsius. So ensure that you're not storing masks within your vehicle for extended periods of time without any airflow, especially on warmer days. Or just take a few with you that you need and ensure that you're bringing them into the sites or your offices as you're going in between them. Again, any masks that have been compromised with temperature must be discarded. They're no longer safe, or can't be, um, the integrity of the mask can't be used. So just ensure you discard those. We have all this information about masks, but how now do we promote mask use? So let's talk about clients or residents first. So clients are more likely to comply with the use of masks if it's explained why they should be wearing a mask. So I'm sure most of your clients have been with your organizations for a longer period of time, and they're likely well versed with the mask use as they've been living throughout it and the previous mandates. And they've probably received as much messaging as they want, but with any organization, there will be turnover and new clients coming from perhaps a community or a different type of home, which their rules or mandates or recommendations might have been different for masking. So messaging for these new clients or those clients that maybe just need those reminders is important. And that's going to continue to promote um, a healthy overall living situation. It could also be the promotion of masks with clients in situations. So maybe your home is a small base community home where the clients are not wearing masks. However, you're taking them on an outing to attend a large indoor event. Perhaps in that situation, you would want to promote mask wearing during this event to protect themselves. So it can be for general overall, or it could be specific situations where you want to promote the use of masks. Either way, we find it's really helpful if you have some canned comments or standardized messaging for your staff to use with your clients. That way, the clients are getting the same message from every staff member. It makes it very clear and concise for the clients that you serve. So we just threw a couple examples up here of different messaging that you could use for them. So lift up your mask, it helps protect you and others. Um, don't forget your mask. We're still in the pandemic. Don't worry, it's just going to be a bit longer. Masking will help keep you healthy. Masking still protects us in these bigger crowds. So that would be an example for a situational issue. So promoting masking with visitors to your facility. So the use of facility signage and social media is going to be an excellent way to get that messaging out for the visitors. So if you are using signage, ensure it's very well visible and not hidden amongst other items. So on a wall with lots of different posters, make sure it stands alone or stands out, perhaps has its own area, front door, whatever is required to ensure that they have that messaging before entering the facility. And then having the signage throughout the facility. So if it's reminders or where to find a mask. So utilizing signage at the entrance, but also throughout the facility. Phone, emails, newsletters, and social messaging can be utilized to ensure the information is received at the visitor's home before coming to the site. So visitors, family, and friends of the clients are always appreciative of the information prior to coming to the home so they can be prepared for what's required and have the resources. It's also in the new guidance documents that states that there should be messaging for visitors. So this is a requirement for a lot of our facilities that they have to have messaging specifically for visitors and for some of them additional training as well. So if you use all these methods, phone, email, newsletter, social media, it's a great way to ensure that everyone receives the information regardless what platform they're using. Again, we typically believe that having a standardized message or having a script for everyone to use ensures that correct information is being relayed to everybody in the same way. So again, if it's a phone call, having that script. If it's an email, it's the same script as the phone call, etc., etc. So we just threw an example up here for a phone for someone who has an organization policy over a required mandate. So again, you can utilize that or adapt your own, but ensure that clear, concise message on goes.
Social media can be an easy way to promote and educate individuals on your organization's policies. It can also bring awareness to the importance of keeping your clients and staff safe. Using these hashtags on your organization's social media platforms, if you have them, is a good way to reach many people at one time. For example, use hashtag wear a mask, asking visitors to respect your organization's policies and to wear a mask in common areas in order to continue to keep activities running as safely as possible. Hashtag mask up so they don't forget their mask on arrival. Hashtag mask on, keep calm and mask on. And hashtag wear your mask for my loved one who can't. We have created some new posters and signage to reflect the changing times with masking that can be utilized for staff, visitors, clients, and other businesses. They are linked here and can be found on our Hub website where they can be downloaded. Thank you for watching our presentation. Please forward any questions to the IPAC Hub at tbdhu.com.